Welcome to the Inclusive Health video course. This course is intended to be used by health professionals such as doctors, nurses, healthcare social workers, midwives, and other related professionals working in the field. The video course consists of 7 modules. They are: what is inclusive health? Disadvantaged groups, basic patients' rights, attitudinal barriers, inclusive communication, quality and inclusive health service and quality standards for inclusive healthcare delivery, general test. It is a self-paced course and you will have the chance to stop and continue at any time you want. It is also a free course, open to anybody interested. In this course, you will learn what inclusive health means and its advantages to the health sector. You will also have the opportunity to increase your social skills in providing services to disadvantaged groups. We will be utilizing a rights-based approach to health and using visual images to help you learn. Enjoy our course. Inclusive health means health for all. The aim of inclusive health requires health systems to identify and adapt the needs of disadvantaged people. It also requires the health services to serve a purpose, helping people gain health and welfare, protecting people from illness and social conditions and deteriorating health, to be just and economical, both for the individual and the society. It also means that everyone should receive a fair treatment independently of their economic or physical conditions. Disadvantaged groups are social groups who have limited resources and are relatively under the risk of illness and death. These groups may consist of disabled, poor, elderly, migrant, asylum seeker, and ethnic groups. Inclusive health delivery means allowing for a range of health practitioners to be involved in providing an acceptable quality of care in the most efficient and cost-effective manner. In conclusion, inclusive health is an attempt to help people think a bit differently about what healthcare is for, how it is delivered, and who deserves to get it. Inclusive health seeks to build on the idea of health for all, and to strengthen it through the rights-based approach, to stress the need for more active inclusion by recognizing that particular groups have particular needs, and that particular barriers have to be overcome to address these needs, and to utilize a much greater range of healthcare delivery options, embodied in a greater variety of human resources for health. Due to recent social changes, such as migration, mounting poverty, etc., health services promoting qualified, safe and socially inclusive service by competent health workers, doctors, nurses, healthcare social workers, midwives are needed within vocational education. Educational needs gradually become more important and call for the need for profession-specific content. Social changes call for inclusive education and training. In addition, sustainable updates, consolidation, and deepening of knowledge is needed. This requires workers to maintain lifelong learning. Regarding social integration and the psychosocial state of disadvantaged groups, it is of utmost importance not to expose social inclusion while receiving health services. Due to the escalation of the migrant crisis in Europe, the number of migrants and asylum seekers who may need to receive healthcare services has increased. Social inclusion skills of health professionals should be developed while providing health services to migrants and asylum seekers who face the risk of constant social inclusion and live under bad conditions. Currently, health professionals who do not have such a training background need specialized training content. Thus, there needs to be a training tool with open source code at a European level, prepared for health professionals to enhance their social work and communication skills. To provide the sector with European tools of learning based on the use of the ICT will contribute to an improvement in the training's quality. There is no training tool as a reference point for this project, nor in this kind of use before. This new and innovative training tool will provide a permanent learning for the development of the activities in more sustainable conditions of the target of this sector and will allow an improvement of the professionalization of the sector, bringing them over to the use of the ICT. Likewise, it will facilitate e-learning. The development of this kind of training program at a European level with the current social and economic situation supposes a high effort difficult to take up individually. However, combining the efforts and the expertise of several countries makes work easier and significantly improves the quality of results, favoring, among other aspects, the skills and mobility of workers in the sector. In general, inclusive health project aims to develop an audiovisual catalogue, training tools for health professionals to improve their social inclusion skills will be an innovative tool for the sector which has never been done before. The course has been developed as a training tool for health professionals to professionalise the health sector in order to develop a social inclusive environment for disadvantaged groups. This curriculum is based on the study carried out as part of the Inclusive Health Project.
Hi, my name is Stephen Murray. I work in Dublin for Aspire Productions, a company who work with people with Asperger's syndrome, giving job assistance to people who want to work in the media industry. I've noticed a couple of kind of blockages for people on the spectrum approaching healthcare. A lot of people will be very anxious going into a doctor, not knowing if they would have knowledge of the condition and whether they kind of be annoyed or frustrated with a person's kind of way of speaking, or that they might be nervous walking in. That some more training to get knowledge of the condition out there, and also kind of some kind of approval that people would know that a doctor is experienced with Asperger's syndrome, and speaking to people with Asperger's syndrome would be very, very helpful in the future.
My name is Veronica Leaney and I am Education and Training Officer with Aspire, the Asperger's Syndrome Association of Ireland. I want to address briefly why it would be beneficial to health professionals to gain an understanding of the reasons why autistic people might become excluded from access to appropriate healthcare not related to their autism. Just a few statistics first. According to the World Population Review, there are 513 million people in the European Union. The US Centre for Disease Control has autism prevalence statistics of 1 in 59. That means that we potentially have almost 9 million autistic people living in the European Union. I don't want to get into a huge degree of detail, but I want to touch on two very relevant points in this area. The first is the work of Dr. Peter Vermeulen around context blindness. Now, this is a situation where a person with autism has a particular experience, and if they have to go and do that thing again, they expect the experience to be the same. So, for example, a young child who goes to their general practitioner in the Irish situation, just with a normal sore throat, and then ends up in hospital and has an operation, will believe that every time you go to the doctor, you end up in hospital and have to have an operation. It sounds a little ridiculous, but the work is out there. It's very accessible. If you just Google Peter Vermeulen, you will see the publications and the research and the practical work that he has done in the area. If a child is prepared, or a young person or an adult is prepared for the fact that different things happen when you go to the doctor with different sets of symptoms, and again, this may seem very obvious, but it isn't necessarily obvious to the autistic person that, for instance, you could go to the doctor with an ear infection to discover that it was a situation where perhaps your tonsils and adenoids had to be removed. The second person I want to reference is Professor Simon Baron-Cohen, who has done a great deal of work in the area of theory of mind. Now, sometimes people simplify this and talk about walking in someone else's shoes. And I suppose to some extent there is an element of that. However, it is more about not understanding why things happen in a particular way, not understanding the other person's perspective. So, for instance, if somebody is standing again in a general practitioner's office, has an appointment for 3:30 p.m. in the afternoon, is waiting to see the doctor is delayed, the person is becoming agitated because of 70% of people with autism also have sensory processing disorder as a secondary diagnosis, so they may be overwhelmed by what's going on around them, the coughing of an old elderly lady, a child crying, all sorts of input, even just the simple thing of the receptionist calling people's names. They're waiting to see the doctor, they're 10 minutes already delayed, and a lady walks in off the street who's had a fall with a very bad cut on her head. Naturally, the receptionist or nurse practitioner will take that lady straight.
This course is divided into 7 modules with a corresponding time frame and activities per session. It is highly recommended that the training to inclusive health be done over several hours, as experience has shown that for participants to absorb the information, tightly packed training sessions are ineffective. For modules on inclusive health curriculum, it is recommended that all modules should be combined with suggested activities. Also, you may need audio and visual equipment to finish all the activities. After finishing all the modules, you are expected to take the multiple choice test. At the beginning of each module, take the time to familiarize everyone with each other and also the facilitator, teacher, trainer. Participants should introduce themselves by giving their name, but also include either their position, organization, and why they are interested in working in the healthcare sector. They might also include a background of how many years they have been working with patients with disabilities and what significant event led them to take up this issue more professionally or voluntarily. In this part, you will have a general knowledge of the project, its aims, and the expected results of the curriculum. In this part, you will see the basic definition of the module, its objectives, and then you are expected to do the activities related to topics. Please encourage the participants' active involvement in activities. For this activity, you are expected to watch a video about the importance of inclusion. In this video, please pay attention to people with disabilities who face a gap in access to quality healthcare. You are looking for possible solutions to people with disabilities who die on average 16 years younger than the general population.
That was a great time being part of a basketball team at the Special Olympics World Games.
My players have intellectual disabilities, or ID, but they could take on any athletes.
Still, a main challenge for these athletes with ID takes place in the health and wellness arena. The reality is a disparity, a real gap between the health of those without intellectual disabilities and those with ID. The gap includes access to quality healthcare for chronic conditions like heart disease or preventing diseases with vaccines.
Sometimes patients like me aren't good at expressing our symptoms. And sometimes doctors aren't trained to understand those of us with ID. For me and my teammates, doctors' visits are often too short. And our lives are often too short because of delays in prevention and treatment. My teammates and I will likely die 16 years younger than the general population. 16!
The solution is inclusion. Get in there. Yeah! Special Olympics has provided 1.9 million health screenings and trained over 220,000 health professionals. We're making sure that those with ID have year-round access to health care, prevention, and wellness programs. These victories of inclusion for people with ID are a triumph for human rights.
So people with ID need your help. Choose to include me at your doctor's office. Include me on your sports team. And include me in your community, so I will reach my full potential and inspire others. Okay, hands in.
The revolution is inclusion.
Got it?
I am an ambassador for the Special Olympics, but I've also become somebody pretty obsessed with sticking up for people who can't stick up for themselves.
In this part, you will see the basic definition of the module, its objectives, and then you're expected to do the activities related to topics. Please encourage the participants' active involvement in activities. The term disadvantaged has been used traditionally as an adjective as if to describe a quality inherent to the group. Disadvantaged groups are social groups who have limited resources and are relatively under the risk of illness and death. These groups may consist of disabled, poor, elderly, migrant, asylum seeker, and ethnic groups. People see themselves as disadvantaged to the extent that they are denied access to and the use of the same tools found useful by the majority of society. A major feature of disadvantage is the presence of barriers to self-sufficiency. These barriers are how people are denied access to needed tools and include unavailability of resources, inaccessibility to resources, and the society's regard for a group, government, and corporate practices. as well as certain conditions of the group itself. In this part you will see the basic definition of the module, its objectives, and then you are expected to do the activities related to topics. Please encourage the participants' active involvement in activities. According to the WHO, as was formalized in the 1948 Universal Declaration of Human Rights, the inherent dignity and the equal and unalienable rights of all members of the human family is recognized. And it is on the basis of this concept of the person, and the fundamental dignity and equality of all human beings, the notion of patient rights was developed. Patients' rights vary in different countries and in different jurisdictions, often depending upon prevailing cultural and social norms. Different models of the patient-physician relationship, that can also represent the citizen-state relationship, have been developed, and these have informed the particular rights to which patients are entitled. In this part, you will see the basic definition of the module, its objectives, and then you are expected to do the activities related to topics. Please encourage the participants' active involvement in activities. Attitudinal barriers related to healthcare services often lead to discrimination toward people with special needs. For example, healthcare providers may overlook mental health and substance abuse needs because they are focused on a patient's disability. This often leads to misdiagnosis or not being diagnosed at all.
Welcome to NIU's Perspectives on Disability MOOC. I'm Professor Greg Long. This is our final lesson in the MOOC. As we've gone through the lessons, you've heard from a number of guest speakers. I recognized, however, when I looked at the entirety of what they had to say, there were quite a bit of perspectives, ideas, and advice that we've not yet been able to include in any of the previous lessons. As such, this lesson is really going to be devoted entirely to the guest speakers. They will take center stage, and they're going to talk first about attitudinal barriers. Then they'll give you some more etiquette suggestions. We've got a section where they'll provide some personal perspectives, talk about the value of educating others, and then end with some advice for students as well as advice for parents. I would like to call your attention to two unique aspects of this week's quiz and activities. During Lesson 1, you were asked to respond to a pretest regarding definitions, barriers, universal design, and person-first language. In this, our final lesson, the quiz will serve as post-test. That is, you'll be asked to respond to similar types of questions. As always, you will have the opportunity to take the quiz as many times as needed to attain an 80% correct rate. The second change in this week's lesson relates to activities. In past weeks, you've had the opportunity to choose among 6 different activities. This week, however, we only have one activity. Specifically, we ask that you write a brief, no more than 1 or 2 page, reflection and evaluation paper. Basically, we'd like to find out what you've learned and how you expect to apply this information. The evaluation part of this relates to suggestions for the course. What suggestions do you have for improvement? For example, what topics and/or types of guest speakers could we include in a future MOOC? With that said, let's move to the guest speakers. In this first segment, they will share some additional perspectives about attitudinal barriers.
One that helped me gather all my books.
In this part, you will see the basic definition of the module, its objectives, and then you are expected to do the activities related to topics. Please encourage the participants' active involvement in activities. Inclusive communication is an approach to communication in which information and its understanding are made available to everyone. To make information accessible to every person, it is necessary to recognize that people have different levels of understanding and specific communication support needs that must be taken into consideration. Inclusive Health sets out 7 principles for inclusive communication to help healthcare providers and health professionals to deliver services more effectively and support people with communication support needs. These principles may operate at individual, local, and national levels.
Hello, Mrs. Smith. How are things?
Oh, I am okay. I suppose it is just that I'm a bit worried about what the doctor said yesterday.
I see. Do you want to talk about what the doctor said?
Yes, I would appreciate that. I've been anxious about what I will do when I go home.
Can you tell me a little bit more about why you're concerned?
Well, I know I'm probably worrying about nothing, but I am worried about the pain.
You're worried about the pain. Is that it?
Yes, I guess so. I will be okay, I suppose. It's just, can you explain about the painkillers again?
Sure, no problem. I know you'll be seeing the pain clinic tomorrow. How about if I explain about the pain medication to you now? You'd start with milder painkillers, then your doctor will give you stronger ones as you need them.
What a relief. I did not know that. Thanks for spending the time to explain it to me. I know that you were busy.
That's okay. If you think of anything else, let me know.
Thanks, I will do that. It is such a relief to have spoken to you.
A man has a severe headache for about 3 days. He decided to visit his family doctor. However, the doctor was very busy because the number of patients peaked that day. Good morning, Dr. Gazelle.
Good morning. What's the problem?
I've been suffering from a severe headache for 3 days.
Do you have any other symptoms?
I also feel tired, neck pain, and I'm shivering.
Let me take your temperature. Your fever is 36.5 degrees. Don't worry, this is nothing serious. I am giving you the medicine and you will be all right in a couple of days.
Thank you, doctor. After 2 days, the patient fainted and he was taken to the hospital immediately. He lost consciousness and his wife was very anxious.
What's wrong with him?
He's not been feeling very well for a couple of days. He was told that he was fine by the family doctor.
Let me read his patient profile. It seems he has a virus which has caused an infection, but we should wait for blood tests.
After 1 hour, the doctor came to talk to the patient.
He has a severe infection and we should start his treatment immediately.
Thank you very much.
At the beginning of each module, take the time to familiarize everyone with each other and also the facilitator, teacher, trainer. Participants should introduce themselves by giving their name, but also include either their position, organization, and why they are interested in working in the healthcare sector. They might also include a background of how many years they have been working with patients with disabilities and/or what significant event led them to take up this issue more professionally or voluntarily. In this part, you will see the basic definition of the module, its objectives, and then you are expected to do the activities related to topics. Please encourage the participants' active involvement in activities. Quality standards are defined as documents that provide requirements, specifications, guidelines, or characteristics that can be used consistently to ensure that materials, products, processes, and services are fit for their purpose. Inclusive health is also one of the areas that are included in the field of health and taken into consideration together with the subject of quality and processes. The concept of inclusive health can be defined as health for all, which seeks to build on this idea and to strengthen it through the rights-based approach. It is very important to determine the criteria of inclusive health services and also the health institutions providing services according to these criteria. That will help meet the needs for all the patients more effectively. For instance, the most important of these criteria is to support and involve professionals working in health organizations. In this part, you will be given a test which covers all the modules. It aims to test general information about the topics.